And now we are back with our program about health and sexuality. 3831-3882 to get in touch with us.
E agora, o senhor
Carlos, a 35-year-old guy from Itapevi, is asking, when I had my phimosis operated, I asked my urologist about premature ejaculation. He prescribed the medicine for my high blood pressure, Aldometi, but I haven't bought yet. Does it help premature ejaculation?
Dr. Alfredo traz?
Well, I have to talk about two different things. I'm going to talk about premature ejaculation. Carlos, you are only 35 years old. If you have a problem with premature ejaculation, you should talk to your doctor about this problem, premature ejaculation. There is nothing to do with your high blood pressure, unless you have an erectile dysfunction due to the high blood pressure. Then we have to see if you are still able to get a boner and for long enough to have sexual intercourse. But since you have premature ejaculation, you probably have a primary or secondary premature ejaculation. Primary ejaculation is the one he has since his first sexual activity, individually or with a partner. So, it means since your first masturbation and since your first intercourse. Then you have a primary kind of premature ejaculation. But if this premature ejaculation got worse after you've had some sexual activity, then you may have a secondary premature ejaculation. It can be made worse due to your high blood pressure. Remember that medicine for high blood pressure and high blood pressure can lead to and will lead to dysfunction for men and for women. So take care of the amount of salt you put in your food. Take care if you are overweight. Take care of your blood pressure with your cardiologist. Because as time goes by, for men and for women, it will lead to a dysfunction. So, this kind of medicine is weird because he is very young to have high blood pressure. This medicine is for high blood pressure. You have to see if Carlos, if you are eating a lot of salt, but it's weird because you are very young. First, you have to see why you have this problem. If you are obese, if you eat too much salt, if you don't exercise enough, if you eat lots of fast food, cookies, chocolates, biscuits. But as far as the medicine is concerned, it's for severe high blood pressure. It's one of the first medicine created. It's really effective for people that have severe high blood pressure. All these medicine for high blood pressure are going to influence your sexual activity. This is one of the first medicines developed for high blood pressure. We use this when we can't control the high blood pressure. Some people, they are going to have 23, 15. And these people only solve when they take this medicine that you are talking about. Now,
Doutora Alfredo já deu uma aula sobre ejaculação.
You have to see why you have this high blood pressure.
E tomar um medicamento.
And you have to see what kind of high blood pressure you have. Severe or mild. Or if you can take another kind of medicine for your high blood pressure. Right? And now there is Sérgio from Itaberaba. I'd like to know your opinion about erectile dysfunction and other problems because I started one treatment but I haven't been seeing any results. I have to tell you the following. It's difficult to have good results in this kind of treatment. We need first to have a diagnosis, to examine the patient, and to find out what kind of problem led to erectile dysfunction. We can have a chance to solve the problem. You are talking about taking medication and not seeing any results. If you are taking Erectile, it only works in some cases, in the very beginning. If you take a pill, and then you have a better erection than without the medicine. But this won't last forever. In some moment, your penis won't respond to that medicine any longer. And then men look for this kind of treatment for erection and start to use injections in their penis. This kind of medicines are also pro-erectile. And they will help you to have an erection in an intercourse. Most of the drugs they use are drugs that will harm the penis, making the erection problem even worse. Every day I treat patients that have already tried these treatments. That's why I do know what I'm saying. Like when they inject drugs, it will make this problem even worse because this drug will destroy the cavernous tissues in the penis more than the disease that you had before. And then the only resource left is surgery, because there is no other medicine that we can use that will solve the problem. So be extremely careful when you use medicine, because these drugs are limited to time, dosage and response to the penis to that treatment. If you can't see any improvement, stop it, because soon there will be no more response. So, Sergio, take care when you take these drugs and ask us again if you have any more questions. A big hug in Itaberaba.
Em Itaberaba.